Dr. Tara Narula joins us at the table to discuss. Tara, I think most people hadn't even heard of this procedure until yesterday. So what is it exactly and how do you discover it?
An embolization is a procedure we've had since the 1970s. And basically the idea is to cut off the blood supply to a lesion in order to shrink it or to prevent bleeding. And so what we do is we take a catheter, which is a very tiny, small tube, almost spaghetti size. It goes up through an artery in the groin, into the aorta, and then into one of the renal arteries, the artery that supplies blood to the kidney. You then find the smaller artery that's supplying blood to that particular lesion. And through the catheter, you inject some sort of material or particles, a gel foam or a coil, that essentially closes that blood vessel off so no blood, oxygen, or nutrients can get to the lesion. It shrinks and essentially that tissue dies.
Is this normally planned in advance, this kind of procedure?
It is, yes.
It was interesting, there were so few details, but one thing they did say was non-benign. So what they're trying to say is not cancer.
They said it was benign, exactly. So exactly, so not cancerous. And there are many different types of benign lesions. We have no idea which one she had. The most common one would be something called an angiomyolipoma, a collection of blood vessel tissue as well as muscle cells and fat cells, can be found in women in the middle age, or arteriovenous malformations or aneurysms.
She'll be there for a week, we're told. Is that normal?
So typically for embolizations, it's an outpatient procedure. You do go home the next day or even the same day. The fact that she's staying for a week may be that they're taking extra precautions. It could be that her lesion was particularly complex or large, or there can be complications rarely, something called post-embolization syndrome, where you can get fever, nausea, vomiting, and pain, or other complications like infection, bleeding in the groin, contrast problem with the IV dye they use that affects the kidneys. So there are other complications that can happen.
All right. Dr. Narula, thank you so much.
Thank you.